Hello, good morning, friends. I am Dr. Sandeep. Welcome to my channel Homeopath. In this channel, I will be uploading videos concerning homeopathic practice and how to take the cases and how to build the homeopathic practices. So, today's subject is homeopathic brewing. So, whenever you come across a chronic or acute case, you must be very conscious of deciding the doses. So, even a single dose which is given in extra will cause a problem for the patients. So, whenever you choose a medicine on the totality basis, you must be very conscious to repeat the medicines. Many a times, a single dose is enough. But what is considered as single dose is a question. 10 pills of a medicine becomes a single dose. But practically, in our Organon and philosophy, the masters, what they have given as guidelines is a substance, a medicine substance which can trigger the curative process in a suffering individual. So here comes a question that what amount of substance is triggering the process of cure? A single individualistic totalitarian medicine or simlimum usually cause a required changes in the economy, but sometimes a repetition, that is 10 pills once, twice or thrice may be required in few cases. So it is all you must be conscious of, and we don't have a measuring scale to how the dose to be adjusted, how to repeat the required medicines. So what we do is we usually give a single dose and wait for the things. So single dose means 10 pills in the morning, 10 pills in the evening, 1 day or 2 days. After that, a indicated medicine does not require much repetition. But if a patient has access to the individualistic medicine and he repeats the medicine unnecessarily, then untoward happenings, a proving effect on the patient is seen. So in that condition, a physician must be very conscious of taking a note of the symptoms of the patient. So how we can evaluate the patient is going into the proving state? It is very important, friends. So recently I had a 15-year-old boy who was suffering from acute fever, and a indicated medicine was clearly showing of arsenical. So arsenical, I gave 50 pills in the hand of the patient and I told him 1 dose or two dose maximum. You stop, and after that you don't repeat the remaining medicines, so that the two doses will complete the cure. But what the patient and the parents has done is, the medicinal effect is very nice, it has cured the symptoms, so they have repeated another three doses. After that, they started coming daily to evaluate and tell that the patient is not at all improved. So I was not confused. I was very clear that the patient is going under brewing. Simply because the indicated medicine, what it will do is, it will cure the patient first. After that, if the indicated medicine is repeated once, twice, thrice, or any times, the brewing of the same medicine will start. So this is a big challenge for the beginning practitioners, how to evaluate it is brewing or is it a different set of symptoms. Here what I done was, the symptoms what he was initially given was not there. Then over effect of the same medicine, arsenic medicine, is coming on his body mind system. That is, he is more overconscious, his UTI has increased, his frequency of urination increased, sleep has totally disturbed. And another very funny thing was, midnight increase of all the symptoms. So I considered it as homeopathic aggravation, and I told the parent, counseled the parent, the patient does not need any medicines, just you wait for 1 or 2 days. But the parents are panicked. So the child went through so many investigations. Investigations are clearly showing that there is no source of infection. There is nothing in the body or blood system which is to be considered as an infectious nature. But symptoms are persisting. And finally, I antidoted the patient so that the symptoms, whatever he is producing, let it be minimized or let it stop the action of the arsenical medicine. But the brewing of a medicine is so deep. By antidote also, our medicines are so much powerful that it goes on doing a symptomatic presentation in his all the parts of the body. So it took almost 7 to 10 days. And mother was complaining, सर 10 दिन हो गए लेकिन बुखार उतरता ही नहीं और सिम्टम्स आता ही रहे. So I was convinced it is because of the overdosing of the medicine. So homeopathic physician should be very careful in acute cases and even in chronic cases to how to repeat the medicines. And he must be in a position to see to it that is it homeopathic aggravation or is it going towards the brewing of a same medicine? Is it overdosing effect of the same medicine? So all the things, if you are clear about, then you can handle the patient. So I antidoted and waited for another 2 days and all the symptoms came down and the patient was very happy. So what I want to tell you is, in acute or in chronic diseases, it is very, very important for a homeopathic physician to take a evaluation of the patient whenever he comes to you. Every time he comes to you, you must note down the medicines so that you can compare with the old type of medicines, old what you have recorded, and in the comparison it will be very clear. So keeping the records about the details of the patients of the symptoms is very very important to come to a conclusion, to come to the what to say like what next we can do. So in our books it is clearly mentioned when the proving is going on by overdose of the medicines, what we must do is we must first antidote that medicine which is proving, and nothing to be done other than that. You give coffee or a required antidotal medicine for whatever you have given. Usually Naxomica is the important medicine which antidotes all our medicines. Coffee is another one, camphor is another one. So there are very similar medicines for antidotal property, and one or two medicine has its own different antidotes. So you must choose a proper antidote for that symptomatology and give the medicine. Another scenario here is we can give complement also. Antidote and complement is nothing but it smoothens the process of cure. So here arsenic and Naxomica antidotes arsenic effects. By the same time, it also complements the arsenic effects. So this should be very clear in the homeopathic physician. So in this scenario, what we must do is wait and watch. If the organal implications, destruction is happening, immediately we must give the antidote and stop that over effect of the medicine. And we must wait for the things to settle down. It will take 3 to 5 days. So counseling is very very important. Assuring the patient and the parents is very very important in these type of cases. So homeopathic posology has a marked implication in our homeopathy. So there is no as such hard and fast rule how to repeat the medicine and what are the situations you must repeat it in a conscious way, and how far you must wait to get the results of the indicated medicine. It is one of the biggest thing in homeopathy. Let it be acute or chronic disease. In acute, there will be immediate effect. In chronic also, immediate effect will be there, but a keen observing physician will take the details of the patients and understand where all the homeopathic medicine given is affected, and he can come to a conclusion. Overall effect it will happen, but a time to effect on the patient's satisfaction is little delayed, because what patients usually expect is improvement in all the symptoms by 1 hour or by tomorrow. That is the expectations of all the patients. So in this type of patients, what we must do, I just discussed today. So this is all today, friends. If you have any queries about homeopathic management, about any homeopathic topics, please put me in the comment section. I'll be doing lives on Fridays and Sundays possibly, and I will record few videos and put you in the same channel. If you enjoy this video, please like, share and subscribe. Now a new button has come. Please hype the video so that it will reach the correct audience and it will reach to our all faculty, so that they can grow by understanding the fine tuning of homeopathic management. Thank you. Take care, friends.